So you need to celebrate their miracles with them. You need to be excited for them. Excited for them as if it's the first time you've seen it. Because for them it is the first time they've seen it. We're blessed to have miracles in our life every day. And you know, we have to be as excited about their miracle for them as we were the very first time we saw something like that. I tell patients, depending on what's going on, you know, if somebody has a stroke, brain injury, autoimmune issue, you have to be upfront with somebody and say, look, this is a marathon, it's not a sprint. You know, I expect you to be a patient for years, if not for the rest of your life. Okay? We're going to have our ups, our plateaus, and we're going to have our downs. You need to let them know that. Because a lot of people, they do really well in the beginning, you know, and by really well in the beginning, I mean somebody who has hemiparalysis and they're able to get up out of their wheelchairs and walk and move around. That's really big, right? But then they kind of plateau a little bit, and then they might get, why aren't I getting better right now? And that's frustrating for them. But if they have the understanding, hey, this is a process, it's a marathon, it's not a sprint, okay? They need to stick it out. But those are the more severe cases that we're talking about, okay? Dr. David Pascal, who's a veteran in working with athletes, he had 39 of his patients go to Beijing. Those patients, 20 of them medaled. 10 were gold, 5 were silver, 5 were bronze.
Quantum neurology will help an athlete perform better no matter what level they're at, no matter where they are, they will perform better with quantum neurology. In addition to that, they'll lower their risk of injury. If they are injured, they will recover quicker. I don't know what else I can say. It's everything for an athlete. In my practice, I really see the patients that are failed cases. They've already seen everybody.
Right.
And then they end up in our office and we're able to help them.
Right.
Because we're approaching it from a completely different level. I know if you want to work with elite athletes, then you need to learn quantum neurology.
And we had another doctor, Dr. Chad Wells. He's, you know, pretty new. He's only out of school 3 years. He's been doing quantum neurology for a year. And he had, I think, about 7 or 8 patients, and one came back with a gold medal. Okay, so very exciting. So, you know, not only do we do this work for the most severely injured patients, the exact same techniques that you're learning this weekend are used with the most elite athletes in the world. Okay, we're here with Dan Neal. And what position do you play, Dan?
Right guard.
Right guard.
Yeah.
And you've been playing professionally with the Broncos for how long now?
It's my 7th season.
Wow.
Yeah.
Congratulations, that's great.
Yeah, I guess so. Yeah.
So, what kind of injuries have you sustained over this time?
Predominantly it's been my left knee. I've had 4 scopes and 1 microfracture, which is the major surgery that I had last off season.
Okay. Now this one, that's a big deal.
Yeah.
Okay. Hold strong. Excellent. Feet together. Okay, come back up. Are you?
Which is good. Yeah, I mean, that's a big difference.
Huge.
Yeah.
Good. Good.
Yeah.
Well, there you go.
It feels
Yeah.
so much better.
See, I can tell the difference because when you first started out, when I first treated you, your butt was really high up in the air.
Okay.
And now you're
Yeah.
clear down,
Yeah.
which is great.
Yeah.
And that's where you can get your power from, having the full range of motion through your movement.
Yeah, I try to get my hips down, not necessarily
Right.
bending the knees, but bending the hips, because that's where your power is
Right.
in this area. So,
Great.
Yeah,
Anything else I can do for you?
that'll be it.
All right, buddy.
That's done more than enough. I appreciate it. Thanks a lot.
Absolutely.
Yeah.
And in quantum neurology, we teach you the neuroexpression concept of the nervous system and how to do a correction with that in mind.
I went online, checked it out, ordered the DVDs, and right after Christmas I started using it in my office, and I could see things were working. I have a patient who's an NFL player He had been in a car accident after the season ended, rolled his Mustang over, fractured his pelvis, multiple rib fractures, pretty severe concussion. His mother brought him in to see me, and so he comes in and he's kind of limping down the hall. I mean, the guy could barely walk. So we just ran through the protocol. We started with myotomes, did those, did the cranial nerves, and then he'd had some shoulder stuff going on, so we did his shoulders, his knees, his ankles, and he got up, and it was like, oh my God, he said, I can actually stand without pain. And when he walked out, it was like he had a normal gait. He wasn't limping anymore. He's like, oh my God, he said, this is amazing. And I saw him 3 more times over the next week and a half, and then he had to go back to Tennessee. And I just saw him yesterday, just before I came down. He was one of my last patients yesterday morning before I left. He came in, we rechecked him. He'd held everything.
Wow.
I mean, went through all the myotomes, all the cranial, went through everything again. And he goes, yeah, I'm feeling great. He'd put on about 30 pounds. And I said, well, are you going to play this year? And he goes, I think I am. He thought his career was done for. I mean,
Wow.
that it was over. And and it was just what I'd learned on DVD, you know.
Yeah.
So
That's,
so I'm really excited to be here and find out what else there is to offer, you know.
A lot of doctors are probably out there like I was originally, just with that healthy skepticism. There are doctors like I see out at the meets that, you know, they don't want to come up and ask because they're not sure what we're doing or how they can. There are just so many questions like, does it really work? How can I incorporate it into my practice? How can I learn it? Da 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 da. And I just have to say that quantum neurology is worth the chance. No matter who you are or what you're doing, I know as a doctor you love to help people, and so I would implore all of those doctors to just come to a seminar and see quantum neurology. The training DVDs are phenomenal. You can sit there at home in front of your computer and actually learn from the comfort of their own home or office. And it's laid out step by step, so everything is totally explained. There's no mystery there, and they can actually take that information and apply it the next day.
in the first seminar, this weekend seminar, Module 1, we focus on the motor rehabilitation and the cranial nerve rehabilitation. Module 2, we focus on sensory rehabilitation. And Module 3, we focus on organ or visceral rehabilitation. So by Module 3, you'll have the full concept of how to work with the full neuroexpression of a patient's injury, illness, or condition. Okay? It's not treating those injuries, illnesses, or condition. We're strengthening the nervous system in the areas that have been weakened as a result of those injuries, illnesses, or conditions. I can't tell you how excited it makes me to teach this work. I really can't. I feel that this work has been a gift in our lives for this purpose, for sharing it with other doctors so that you could see results in your life and in your patients. I truly feel that way. And, you know, I ask you please to tell all your doctor friends about this work, tell your patients about the work, tell them all to visit our website and see for themselves. And tell them your experiences so that they understand that quantum neurology is a powerful healing tool that I feel is going to change the way medicine is practiced. My name is Dr. George Gonzalez, and quantum neurology is a rehabilitative technique that's unique because we focus on rehabilitating the nervous system. We use neurological tests to guide the patient's care. We use light therapy to upregulate the patient's nervous system in order to help the body heal itself. The inspiration behind quantum neurology was my wife's spinal cord injury. She had injured herself and she became numb between the navel and her backside and behind her legs, bottom of her feet. And all the doctors and all my training in chiropractic school wasn't able to address the issues that she had. So I started studying neurology and I made these associations which have become very powerful nerve rehabilitation techniques. They not only worked on my wife in her complete recovery, they've also helped countless doctors and their patients achieve success with their rehabilitation goals. Quantum neurology can be done on any patient with any condition, any injury, any illness. We're not treating those injuries, illnesses, or conditions. We're rehabilitating the nervous system so that the body could heal itself. The range of correction that we've seen in quantum neurology is unlimited. We've seen patients with severe aneurysms, strokes, brain injuries, traumatic brain injury, autism, ADD, dyslexia. All those types of patients respond very well to this type of rehabilitation. This technique also works on high-level athletes in increasing their performance. I invite you to experience quantum neurology for yourself. Check out our website, quantumneurology.com. See our case studies, our videos, our testimonials, and see for yourself how neurological rehabilitation can change your life.